YouTube is live, Facebook is live, Instagram is live. Okay, calm down. 30 seconds, calm down, start.
Hello, everyone. You're welcome to another episode of A Day with Your Fertility Specialist. My name is Precious Adama, and I'm going to be your host for today. Thank you for tuning in. Thank you for all your likes, your support, your comments, your engagement. We really, really appreciate. On today's episode, we're going to be talking about ovarian rejuvenation with PRP. Is it a hope for low ovarian reserve? Over time, we've been talking about the ovarian reserve being the quality and quantity of eggs that the woman has. And we also talked about its depletion with increasing age. What if someone tells you that there's a cheat code, there's a remedy that could stimulate the ovaries to produce more eggs after the age of 40? Might be true, might not be true. So you stick around to find out more information about this. So, to elaborate more on our topic, we have with us Dr. Debbie. Good afternoon, Dr. Deborah.
Hello, Precious. Good afternoon, viewers. It's always a pleasure to be here.
Thank you. You're welcome, ma'am.
Thank
So, a
you.
brief introduction for those of us that might be joining for the first time. Dr. Deborah is a family physician. She's the head of the IVF team here at Alps Hospital, and she's also a fertility expert. So, feel free to drop all your questions because the answers are here. Welcome once more, ma'am.
Thank you.
So, let's dive into the basics for now.
Okay.
What is ovarian reserve and why is it talked about very often in our fertility talks?
All right. Thank you very much. So, when you talk about ovarian reserve, we are talking about the number of eggs that are left in a woman's ovaries. And are we talking about reserve? And this is because a woman or a girl or a female child at birth is born with all the eggs she would ever have in her lifetime. Then each from when a woman enters what we call menarche, when she starts menstruating, so each menstrual cycle, a cohort, that's a group, a batch of eggs starts developing. At the end of the day, just one reaches the size that it is ovulated, for it to be fertilized by sperm and then for pregnancy to happen. The other eggs that all started, developing in that batch will all die away. So this happens every menstrual cycle. And you see that this amount of eggs she was born with in the millions at birth, it's diminished, becomes, the number starts reducing with time. So at a certain age, this reserve declines, significantly. From about the age of 35, ovarian reserve declines significantly. So that's what we mean when we say ovarian reserve. How much eggs does a woman still have in her ovaries at a particular time in her life? And it's very important when you're talking about fertility because the amount of eggs you have left gives an indication of your reproductive potential, the ability for you to get pregnant. If you don't have any eggs left, then the chances of getting pregnant are zero or very, very slim. So it gives us an indication of, is this woman going to be able to use her eggs or get pregnant? So that's how ovarian reserve helps us with regards to fertility.
Okay, thank you very much. So you said it's the number of eggs. Is it also the quality of the eggs?
Yes, somehow it's not necessarily quality, but it can relate to quality.
Okay.
Yes, because like I said, ovarian reserve declines with age. And then egg quality also declines with age. Because a woman is born with all the eggs. All the eggs have been produced at birth. So the eggs that you have left in your ovaries at the age of 35 are very old. A lot of these eggs, a lot of changes, damages have taken place in them, chromosomal damages, so their qualities are reduced. So somehow ovarian reserve might be related to quality, especially low ovarian reserve, especially at particular ages, might be related to quality, but it's not a directly linear relationship because there are some conditions where women have a high ovarian reserve or have normal ovarian reserve at an advanced age, but that doesn't translate to better quality of the eggs. Yes. So, for example, a condition like polycystic ovary syndrome, a woman in her 40s, when a woman gets to her 40s, in a woman that doesn't have polycystic ovary syndrome, the ovarian reserve is usually really reduced. But for a woman with polycystic ovary syndrome, the reserve will be at more than what you expect for that age. But that
Okay.
does not translate to better quality of eggs. Yes,
Okay.
and even in a younger woman that has polycystic ovary syndrome, her
Yes.
ovarian reserve is usually high above the normal range. But that does not translate to quality or lower quality. But we know that ovarian reserve depletes or reduces with age. So if it's
Okay.
due to age, related decline in ovarian reserve, we know that the quality of the eggs will also be reduced.
Okay. All right. Thank you. Thank you. So when someone is said to have low ovarian reserve,
Yeah.
meaning they have their quality of eggs have
No,
depleted,
number of eggs.
number of eggs have
Yes,
depleted.
yes,
All
number of
right.
eggs as depleted for their age. Because
Okay.
ovarian reserve is not stagnant. For
Yes.
a particular age, there's a reserve you expect.
Okay.
Yes, the ovarian reserve for a woman that's 20, 25 will not be the same as that for a woman that's 30 or 35, or even for a
Okay.
woman that's 40. So for a particular age ranges, there's a reserve you expect. So when the reserve is below the range for that age group, you
Yes.
say that the reserve is reduced.
Okay.
Yes.
All right. Thank you. Thank you. Good to know. So what is PRP and how is it prepared?
Okay, so PRP is an acronym for platelet-rich plasma.
Okay.
Yes, so it's prepared from the client's or the patient's own blood. The
Okay.
blood has different components,
Yes.
the liquid part and the cells, the solid part, and there are different kinds of cells. Platelets are an example of one of the cells in the blood. We
Okay.
have white blood cells, we have red blood cells, and so on.
Yes.
So this blood is concentrated using a centrifuge. Then the platelet-rich component of the blood is now extracted. So that's what is used to get this platelet-rich plasma. And it's because platelets have growth factors in them that can stimulate tissue to develop.
Okay.
Yes, so that's why that part of the blood, that is what is extracted.
Okay. So what is ovarian rejuvenation with PRP?
Okay, so
It's
ovarian rejuvenation, when you talk about rejuvenation, it's as if
Yes.
you are trying to return something back to its original function or to
Yes.
improve. Yeah, so ovarian rejuvenation is an attempt to stimulate the ovaries to produce eggs again. I told you that a
Okay.
woman is born with all the eggs she will have in her lifetime.
Yes.
So a woman does not produce eggs any longer. You just take from that reserve. Each menstrual cycle, you take from that reserve. Yes, so ovarian rejuvenation is an attempt to stimulate the ovaries to produce new eggs in layman's term. So you are
Okay.
injecting the platelet-rich plasma, platelet-rich plasma, the PRP, to
Yes.
stimulate. PRP has some growth factors and other factors, which are what the tissue uses to produce new cells, new tissue. So this is an attempt to stimulate the ovaries to produce new eggs. So that's what ovarian rejuvenation is about.
Okay. Okay. Thank you. So how is this PRP introduced into the ovaries?
Okay, so
How?
it's introduced through a very simple, small, minor procedure.
Okay.
The woman is not cut open, but it happens in the theater
Okay.
using some special devices like a long needle. You need an ultrasound machine.
Okay.
This PRP is injected directly into the ovaries
Oh.
at several points. You just inject it directly into the ovaries and
Okay.
allow it to work to stimulate the ovaries to start producing new eggs.
Okay. So how does it actually work? Does it actually create new eggs or it just improves the function of the existing follicles?
Yeah, so it works in multiple ways. One is to try to stimulate the ovaries to produce new eggs. And another function is to enhance the function of the ovaries, which you
Okay.
can do by improving the function of the existing follicles. Follicles are the houses that houses the eggs.
Yes.
The eggs develop inside the follicles.
Yes.
And then also helps the hormonal milieu in the ovary, making the ovaries more responsive to the hormones that enable follicles to develop. So it works
Okay.
in several ways.
Okay. Right. So who is considered a suitable candidate for this procedure?
Yes. So for PRP, PRP is used for different people, but the most suitable people for this will be candidate people that are young and maybe had what we call premature ovarian failure. There are people that before the age of 40, they've stopped seeing their menses. Some even
Yes.
before the age of 35, they no longer menstruate. The ovaries just stop functioning before time.
Okay.
Yes, so those kind of people are good candidates for this.
Okay.
Also, women that are perimenopausal, That's perimenopausal is a woman that is perimenopausal is just a woman in those years before the menses stops finally. In
Okay.
those years before a woman stops seeing her period. So usually in the perimenopausal period, a woman's period is not regular. You know, those are also those kind of women are also good candidates. And clients that
Okay.
have had IVF and then the number of eggs they produce were few, that had a poor outcome to an
Okay.
IVF or a fertility treatment.
Yeah.
Ovarian rejuvenation can also be used in those kind of clients. Yes, and then
Okay.
for people that say they do not want to, women in the menopausal range, who are menopausal,
Yes, ma'am.
postmenopausal, and say they
Yes.
do not want to use donor eggs. So ovarian rejuvenation is something they can try to, even for anyone that says I don't want to use donor eggs and is
Yes.
not producing eggs, adequate eggs, ovarian rejuvenation is something she can try to.
Okay. So from this explanation, it's safe to say that a woman with diminished ovarian
Reserve,
can
yes.
actually participate in this.
Yes,
Hmm.
any woman with diminished ovarian who had an
Okay.
IVF or fertility treatment and the person had a poor outcome, very few eggs gotten, or even the
Yes.
eggs gotten, the qualities were very poor. That kind of client person is a client for ovarian rejuvenation.
Okay. So can we say that ovarian rejuvenation is suitable for every woman with infertility?
No, it can't be suitable for everyone with infertility
Okay.
because we have different causes of infertility. If the cause of
Okay.
the infertility is severe male factor infertility, ovarian rejuvenation will not address that. Yes,
Okay.
there's something we call testicular rejuvenation.
Okay, for the
That
men.
yes, but it depends
Okay.
on the cause of the male infertility. Now,
Mm.
what is causing will determine if testicular rejuvenation would help in that situation. So
Okay.
no, it's not just for any woman that's suffering from infertility. It
Okay.
must be infertility due to diminished ovarian reserve or poor eggs or
Quality.
decrease in the number of eggs that's been gotten from her.
Okay.
Yes, so not just any kind. If infertility is due to uterine factors like adenomyosis or
Yes.
intrauterine synechia or adhesions, ovarian rejuvenation
Would
addresses the
not
ovary,
cover.
so it will not address that.
Okay. All right. Good to know. So does age influence the chances of success with
Definitely,
PRP? Okay.
definitely, age is a very big factor, and that's why I was mentioning that younger age women,
Yes.
maybe that have premature ovarian failure, would benefit better than a woman that is more advanced in age and is menopausal. Yes,
Okay.
so
Yes.
a younger age woman will benefit better from this. Though it has been tried in all ages, yeah. Research have showed some outcome in all
Yes.
ages. Yes,
Okay.
though this research is still limited and few in between. Yeah, but a lot of research is going on. Like I
Okay.
said, this ovarian rejuvenation is a interventional treatment. It's like an investigational treatment. Yes,
Yes.
so it's something we do a lot in our center, and we've seen outcomes from it. And though in some cases there might be little or no outcomes that we've seen.
Okay. So I'm sure since PRP is like a modern science, people would like to know if it's a standard fertility treatment or it's still experimental.
Well, when you say something is experimental, anything started as experiments. When you say experimental, that means just few people are aware of it or even
Okay.
utilizing it. Like ovarian rejuvenation is not something that's so widespread now. Very
Yes.
few centers, actually do it. So in that way, you can say it's experimental. Yes, it's also experimental in the sense of the amount of research that has really been done on it. Since not so many people are doing it, so
Yes.
research is somehow limited on it. Yes.
Okay.
So, but it's not experimental in another sense because results are also being gotten from it.
Yes.
Yes.
People have
It's just that it's not so
benefited.
widespread. It's not common knowledge. Not so many people are aware of it or using it. So in
Okay.
that sense, you might say, okay, it's experimental.
Okay. So what success rates have been reported so far for
Okay, it will be
PRP?
difficult to put figures to success rates because like I said, when you talk about success rates, talk about doing research, you talk of having there must be enough sample size,
Yes.
yes, for you
Yes.
to now be. You can't say you're working with 5 people and you want to talk about success rate. Yes, uptake is still improving. Like I said, it's not something so widespread now. Uptake is still improving. Success rate is varied. Like in our own experience, success rate is varied. Yeah, we've seen a young lady that wasn't even menstruating before with ovarian rejuvenation, started menstruating, went on to have
Wow.
an IVF, and had a child at the end of the day from it. Yeah, so success rate is varied, but like I said, the younger the age of the woman, the better the outcomes.
Okay.
Yes, and then for the older age women, they might need to have more than one session of the ovarian rejuvenation for you to even see some outcome,
Okay.
yeah, some
That's for the
benefits.
elderly
For the elderly,
ladies.
more women that are
Okay.
more advanced in age, yes.
Okay. Okay. So should patients view this as a guaranteed
No,
solution?
it's not a guaranteed solution. It's not a
Okay.
guaranteed. It's just another intervention. It's just another outcome, another thing you can try, especially for women that are adamant for reasons of religion or culture, are not open to using donor eggs. So this is something can be done. This is something that can still be done, yes. But
Okay.
there are no guarantees, yes. Like we say with IVF, there are no 100% guarantees.
Yes,
Yeah, with
definitely.
this too, there are no 100% guarantees.
Okay. So, what does the procedure actually involve? Is it painful? Are there side effects associated with it
Okay, so like
afterwards?
I said, it's a minor procedure in the lab. Yeah, a needle is involved, so there's slight pain, though they're giving some anesthesia.
Okay.
Yeah, they're giving medications to reduce pain and all that. So if it's done in the hands of experienced people, almost no side effects.
No side
Yeah,
effects.
yes,
Okay.
there's no side effects. You go
Okay.
home that very day, you have your procedure, you go home that very day.
Wow, that's
We place you on
nice.
pain meds, give you antibiotics just to cover prophylactically, and
Okay.
a lot of clients, we've not had any issues or complaints of any issues for any client that's had ovarian rejuvenation.
That's very good. So there's no like recovery time. It's
People recover immediately. I said they
immediately.
go home.
Wow.
Yeah,
Wow.
once
Wow.
the analgesia as well
Yes.
weird off, they go home immediately. Yes, so
Okay.
no recovery time. It's a day procedure. You come in, have your procedure, you go back home that same day.
Okay. So I'm sure people would like to know how soon after PRP can someone try to conceive or begin their IVF journey?
Okay, so we usually do the period and allow a month
Okay.
for it to work. So within a month you can start. If you
Okay.
are not told that you need more than one session, like I mentioned, some people might need more than one session of the PRP, depending on what their ovarian reserve was at the
Okay.
inception. Yeah.
So in your experience, you've had a lot of patients that have benefited from PRP,
Well, I
ovarian
would say,
rejuvenation.
yeah, a lot of clients have, uptaken. We've had a lot of clients have had ovarian rejuvenation. The benefits have been, both sides. Yeah, some people have benefited and gone on to succeed, but we
Yes.
also had clients that have not, succeeded with it. When I talk about success, the success is in terms of now having um a fertility treatment and then getting pregnant. Yeah, we've had some clients that that has not happened for
Okay.
years.
Okay. So what realistic improvements do you hope to see after the treatment?
So after the treatment, the realistic improvement we hope to see is, for a woman that maybe wasn't menstruating before, menses returned, the AMH, that's one of the things we check to determine ovarian reserve. It's anti-Mullerian hormone. The
Okay.
value increases, or for a woman that had an IVF previously and the outcome was poor, when she has another IVF, the outcome is better. We get more eggs this time, better
Okay.
quality eggs this time. Those are the outcomes
All
we
right.
expect.
Thank you. So are there any kind of patients that you advise against PRP?
Well, there's no you there are patients that we as doctors you give counsel, you tell them all the advantages and disadvantages, you tell them what you think is the best way to go,
Yes.
but a client has autonomy, after giving informed, you're giving all the information, the client will make their choice. And
Yes,
yes,
definitely.
yes, so there's no patient. If a patient doesn't need ovarian rejuvenation, the patient won't be counseled for ovarian rejuvenation. Do you understand what I'm saying? Like
Yes,
I've
I
said, that
understand.
we have different causes of infertility. If ovarian rejuvenation will not tackle or help to solve that problem, there's no
Yes.
point having an ovarian rejuvenation. So
Okay.
usually we counsel clients for ovarian rejuvenation when they need it. Do you understand? We counsel clients for ovarian rejuvenation, but there are some clients, as you're counseling them, we're telling them, oh, this is your, after doing this, your chance of success with this might not be as great as this. This might be your best way, the best way to go. But these are other options, other things we can try. So the
Yes.
clients will now make their decision about what they want to do. Like I've
Okay.
said, there's some clients that based on their religion, cultural background,
Yes, and
they're not
beliefs.
open to donor egg IVF. Yes. So ovarian rejuvenation might be the only thing they can try. And we
Okay.
hope, it succeeds at the end of the day for them.
Okay.
Yeah. So at least it still gives them hope that there's something they
Yes.
can try. and then you just removing all hope that there's nothing else to do. So it's something else that can be tried.
Okay, thank you. So, what advice would you give to women diagnosed with low ovarian reserve who see advertisement of PRP promising miracle results?
Okay, so yeah, so you need to come in for a proper evaluation.
Yes.
People advertise differently. You need to come for a proper evaluation. So following the evaluation, we will now counsel you and tell you the chances of success with the PRP. If we think PRP is not the best way to go, we tell you other things you can try, but we will not coerce you to make a decision. You will make your own informed choice. The client will choose for themselves. Yeah, there are
Yes.
no miracle results with PRP. Like I've said, sometimes you might need to do the PRP more than once,
Yes.
for you to get the results you desire. And sometimes you do the PRP and it still doesn't work. You know, it still does. Sometimes you do it and it still doesn't work. But we give them other options and things they can try. If the client is open to it, then those are other ways to go.
Okay, thank you very much, ma. So let's just divert a bit. I know we're talking about ovarian rejuvenation, but you made mention of testicular
Yes,
rejuvenation for
yeah,
the men. So how is
yes.
that like? Like, do we often do it as often as we do the ovarian
Yeah, well, the
rejuvenation?
uptake is not as much as the ovarian regional, but yes, we do it for clients too. Yes,
Okay,
people that have problems with spermatogenesis, and
okay,
the men, they are properly evaluated, and that so testicular rejuvenation is an attempt to cause the testis to produce
okay.
sperm
So it
cells
helps
to.
with low sperm count.
Yes, it helps with low sperm count.
Okay,
Yeah.
that's for ages above like 35 or any age at
Any
all.
age, low sperm count is not age bound. Yeah, we've seen very young people with no sperms, even azoospermia. Yeah,
Yes.
so depending on the cause of the low sperm count or azoospermia, testicular rejuvenation might be able to help. It
Okay.
depends on what is the cause. That's why they
Of the
must be
cause.
properly evaluated to
Okay, so
try
you
to
have to
find out the
carry out.
cause first. Yes.
Okay, all right. Thank you so much, Dr.
Thank you.
Debbie. This was a very, very nice session and it
Thank
was
you for having
impactful.
me.
Thank you so much for being with us here on set. And to all our viewers, thank you for tuning in. Thank you for joining us till the very end. It's safe to say that we all learned something new because I definitely did. And just to note, this is not just theory. We actually carry out all these
Yeah.
services here at House Hospital. So feel free, if any of these piqued your interest, you can
Yeah.
reach out to us. So, and we're always here to serve you. Thank you so much for tuning in. Don't forget to catch us our next session. We do this every Wednesdays and Fridays, 3 p.m. remains the time. Catch us on Instagram, catch us on YouTube, on Facebook, on TikTok. Thank you so much. Do have a lovely day ahead. Bye. That was so long. Why?